Think we'll go ahead and get started in the interest of time here. Welcome, everyone. We are so thankful for you joining us today. I'm really glad you're here for this conversation because it's one that we're hearing consistently across the country, regardless of program or state or the size of the agency. Health and human services organizations and the workforce pressures that they're feeling is real, and it's growing in strain. Caseworkers, social workers, those frontline staff that are so important to deliver these critical programs are carrying increasingly complex caseloads. They're navigating more rigorous compliance requirements, and they are doing deeply human and emotionally demanding work, often with systems where the tools that were not designed for supporting how work actually happens in the field. Many of these systems, these legacy systems, aren't even available in the field. And those that are were intended to be data collection instruments, not so much supportive of practice. And the reality is that we really need to be sure that we're supporting our workforce in all of the ways that they need, whether that be technology, the way that we support and supervise them, the culture that we create, all of that. When the workforce is stretched too thin, we see it everywhere. We see it in delays in service, increased compliance and risk, high turnover, and loss of institutional knowledge. So today we want to center our conversation today on a simple but critical question. How do we best support the people who are doing the work right now? Not in 5 years, not through a large-scale system implementation, but what can we do from a practical and meaningful perspective to improve the day-to-day experience and help agencies stabilize and strengthen their workforce? So we're going to go through all of that today with you. My name is Carol Hussey. I'm co-founder here at HHS Connect. We also have with us, helping with moderating and monitoring the chat and all of that, my partner, Kristen Bird. And we have here to share their experiences with us, Dr. Jacqueline McKnight, who we have the pleasure of working with. She's a partner at HHS Connect, and she's a national, just amazing person who has lived on the side of working for states and cities and now is an advisor to these organizations nationally. So we're grateful for you being here today, Dr. McKnight. And then we also have Patricia Donaldson, who is the EVP of Global Sales at Diona. I should have the speaker slides up here so you can see that as well. And just a couple of quick tips before we get started here. All the usual things. We all do Zooms all the time, so nothing new here. But what I will share and point out here or highlight for you is that one, if you joined late, the session is being recorded. We'd like to make sure that you're aware of that. We'll also make that available to you after the session so that you can revisit it, share it with other colleagues who might not be able to be here today, who might benefit from that. We'll send those links out after the session. Also, too, we like these sessions to be highly engaging. So please do add questions to the chat. We will be monitoring that along the way and fielding them in context. So you don't have to wait to hold your questions. We would love to have that type of conversation with you. We are not going to be slide heavy today, so we're just going to make this a conversation. So I'm going to stop sharing my slide and we're going to actually just have a little fireside chat with you today. And we're going to start really just kind of talking about the reality of today's HHS workforce. What are the things that are really straining the workforce, and why is that so important for us to understand? So Dr. McKnight, I'd like to start with you. If you could just share with us what, in your experience and now as an advisor, what are agencies facing now relative to this workforce crisis that we're seeing?
So first of all, can I say thank you, Carol, and I want to also acknowledge Patty and for having this opportunity to have this critical conversation. And I'm just going to share some of what I have seen as some of the realities. Child welfare and social services overall face an attrition rate anywhere between 20 to 40% annually, with areas sometimes as high as 60%. Now, these rates are actually double and triple what the actual standard is, which is 12%. We also have to recognize that we are still grappling with the aftermath of COVID. If you remember, we had the Great Resignation or the Great Reevaluation, which has only exacerbated an already challenged workforce. What we are also seeing is significant burnout. And that usually manifests itself with loss of passion for the work, clients not getting the help that they need, as well as potential ethical violations. There is also emotional fatigue, low compensation, and intense stress that actually drives these trends, these high rates. As staff exit also, their workloads still exist. Therefore, the work has to be reassigned to the remaining staff members. Therefore, workloads are above standard. There is also the vulnerability of those that are served through social services. Their needs are complex. This does not stop the regulatory demands and or the pressure to comply. Often, those who are serving in social services are also recognizing the importance of safety for their clients, but they also have to recognize as they go out to engage and go into the community, their own safety as well. One last point I'm going to highlight and turn it back over to Carol is that you're going to hear me repeat the sentiment often throughout the presentation. As we consider the needs of workforce in any system design, it is essential that we speak to those who are doing the work and ensuring that their voices are integrated into any processes that you put in place. You only get to begin your work once. So you really want to have an attempt to do it as seamlessly as possible. So to really enhance the buy-in, you really need to have your line staff seated at the table to plan any efforts. And I just want to share, it's been some time since I have done line work. However, as Carol shared, I've had the opportunities to work alongside many individuals in large operations. And what I've noticed is that the workforce does not shrink back. They have voices. They want to be heard. And we really need to make sure that we're including any of their recommendations as we roll out any, again, system designs.
Yeah, it's so essential. It really is. And you'll hear more from Patty in a little bit about even at the design aspects when a product company is developing solutions, they should be incorporating that need, those voices in the design of the solution as well. And then right out of the gate, when you bring them to the table to begin that configuration process for your organization, you'll see that very evident in the design of the product. So that's something just as an aside to sort of look for when you're looking for a vendor that you're going to work with, whether it be, a mobile solution or other types of solutions that you might be implementing. But the workforce issue is real. All of the things that Dr. JOMcKnight highlighted are so on point. Patty, I didn't know if you had anything else that, you're often in the front line delivering these solutions. Are you seeing anything beyond that or other sort of things that you might want to add on to that?
Yeah, no, well, first off, thank you, Carol and HHS Connect for organizing this conversation. Dr. JOMcKnight, I loved your statement about having voices at the table, the voices of the people doing the work. And I think often we find that's an afterthought, which is very, very problematic for any solution you're going to do. We like to think about when designing for caseworkers, you really need to have a caseworker first mindset. You really need to be focused on those moments of engagements, and those moments are really different by a situation. So yeah, I really love that statement, Dr. McKnight.
Yeah, I do too. So we understand now the risks, the complexity, the challenges that organizations are facing specifically to the workforce and, those individuals. But when we have a workforce that is strained in all of those ways that we just discussed, there are certainly strategic and significant programmatic organizational implications as well. So what would you say, Dr. McKnight, leadership should be thinking about at the program level in terms of risk? How do all of these things impact the organization, their mission, and all of the things that they are really tasked with doing each day?
Yeah, I'm going to take a risk here and be a little provocative. Um, Due to the challenges of stabilizing the workforce for the area of social services, it's imperative that supporting the workforce becomes a key lever in competent leadership, not just something we do as a matter of fact, but a key lever. In the area of social work, we often speak to the process of parallel process. We talk about it from the perspective of that if in fact you support the staff, then they are more inclined to be able to support their clients and customers in a more meaningful way and have a better experience. It's almost that same concept of putting the oxygen mask on you first, and then you're able to go out there and meet the needs of those that you're charged to serve. So leaders are clearly required to ensure that their staff members are doing the work. That's clearly a responsibility of leadership. But they are also responsible for properly supporting that workforce, to make sure that the issues are being addressed that don't put the program at risk. And that's a key issue. There is also the relationship with HR. A lot of times we kind of say, well, these issues are HR issues. And don't get me wrong, I believe that HR is absolutely a key stakeholder. However, leadership needs to be intimately involved in developing strategies to stabilize the workforce. It shouldn't just be on the outside, it needs to be part of their role. I'm actually consulting in a jurisdiction that is actually retooling their whole onboarding process, because what they are seeing is that they haven't necessarily bring always the right people into the front door, but also when they do, what are they doing to support them? What does that look like in essentially retaining the individuals that they're bringing in the door? Again, I do want to also acknowledge that there is a cost to burnout. As we cited earlier, there could be delays in services, risk in compliance, and as well as the fact that when staff leave, you're losing their experience, their institutional knowledge. And there is a financial component to this. It is well cited that when you have attrition, that there is at least 50% of that salary actually is going to need to be utilized for recruitment and training of staff. So there is a financial component as well. And here's where I want to kind of push a little bit. Therefore, I'm stressing that those organizations that are actually participating in today's webinar, that they take a look at their strategic business plans, blueprints, whatever you are actually utilizing to kind of structure your work. Do you have a component that really addresses workforce support? Which I am going to stress again that it is absolutely a key lever in leadership.
Yeah, that's also great. And I've certainly read a number of studies, I'm sure many of you have as well, relative to the cost of turnover. We've known that for years. And in certain human services programs like child welfare, for example, that turnover has a very direct correlation to the outcomes for children and families. And so it's far beyond, the impact on your operations or compliance. Like there are real impacts to the families that we are trying to serve. And so that direct correlation between how staff feel and if they're supported does tie back to many aspects of mission, operations, compliance, financial. There's many implications. So we all can agree that we want our workforce to feel supported. Oh, one other point on that too, which we've talked about in a number of topics, is supervision, right? Like, because we have such a big turnover, our caseworkers are often promoted into supervisory positions, perhaps earlier than they should be, or they're not prepared to be. And we do have a number of webinars coming up and programs available relative to supervisory supports and that sort of thing as well. So I'll give a little pitch for some future things from HHS Connect all around supervision, because we know that's so critical. But yeah, so a million reasons why we want our workforce to be supported and to have the things that they need to be able to do that. There are a lot that fall outside of the realm of technology, but technology actually touches on a lot of those things that we just talked about. Tech is not just about processes and forms and things like that. It weighs into each of those things. It helps me as a worker to feel valued and supported if I have the right tools to do my job. And it certainly, has all those operational benefits as well. But Patty, let's shift a little bit into like the technology realm here, because this is where things can either help significantly or unintentionally make things worse, right? Like we've seen that. I'm going to build a new system and it's going to be great. And, we take 3 or 4 years to do it and we flip the switch and all of our workers hate it. I think we've all seen examples where technology added steps instead of removing them, or it was just so significantly different and our workers weren't prepared for that. So where do you see some technology implementations or modernization efforts even falling short in regard to workforce?
Yeah, thanks, Carol. I think we've highlighted this a bit, but often what we're seeing is that it's not technology's fault necessarily. It's what we've asked the technology to do. And going back to Dr. McKnight, that's sometimes because we don't have all the right voices in the conversation. And if we're not leveraging technology to support practice, then it feels to our caseworkers as if we're just adding technology to collect information. And at that point, a caseworker is not feeling supported. They're actually feeling burdened. So as I started to mention before, one of the things that we really need to be thinking about is how are we caseworker first? How are we thinking of a caseworker's mindset when we're thinking about how we're going to implement technology? And that means really being focused on their moments of engagement. And those moments of engagement are different depending on the situation. A child welfare caseworker sitting down at a table for an ongoing case is very different than an investigator who maybe is standing at the front door. It's also different for an eligibility worker who may be sitting with a client at a desk. So we really need to think about those moments and think about what information a caseworker might need during that time and what things they need to complete. And what's really important is that these use cases are going to be different, not only based on what a caseworker's style or approach is, but also often they are engaging with other stakeholders, meaning children, families, clients, and the needs of those individuals are incredibly different too. So we need to be thinking about how do we ensure the outcome we want to achieve is achieved, but provide flexibility in that moment of engagement for varying caseworkers and varying clients to get to the same place. So for example, if we just took the example of documenting a case note or documenting a progress note, There are lots of different ways that can occur. The outcome we need is a timely case note documenting what's happening with this family or with this client. But some clients are going to want to talk about the weather first and then maybe their children next. Other clients are going to want to get right after it. Some more experienced caseworkers may still like to write information down. Some of your newer workers may like to use talk to text or audio recording. So it's thinking about not prescribing the specific way that that needs to be done, but creating flexibility in how you do that so that you can ensure the outcome is achieved, which is a case note or a progress note, but not try to sort of force this one size fits all. I think today technology gets a bad rap a lot of times because of that approach of one size fits all. And if you think about the experience of your workforce again for a minute, what you really want to be doing, especially as Dr. McKnight talked about, staff overturning and issues and concerns around retention, what we want to be thinking about is how do we make things incredibly intuitive, easy to understand, so that the focus of our newer caseworkers is really on practice and policy, not on systems. Often what we find, especially as we talk to newer caseworkers, is that they did not decide to become a caseworker so that they could learn how to use a massive case management system. And again, I would never disparage a case management system or an eligibility system. They are incredible in what they need to do, which is to capture a lot of information to make sure that we can report on that information. What they're not inherently good at is actually supporting those moments of engagement that a caseworker needs. And that's why oftentimes social work happens and then documentation happens. We want to really move to a world where, as part of doing your work, your documentation is happening, your capture of information is happening. And that's really this mind shift of thinking caseworker first and not thinking, what's the data I need? Because again, if you think about what the caseworker needs in that moment and what they need to capture and the information you need for that family or the details you need in order to determine their eligibility, you ultimately will be getting the data that you need. But there needs to be a different approach for us to take around just how we're supporting caseworkers in doing that. And really thinking about your workforce, thinking about their expectations, thinking about, as Dr. McKnight already pointed to, their caseloads. We need to come up with ways that allow these workers who came to this profession to help families. We need to come up with ways to better support them in those moments of engagements with their clients, where that information and the things they need to be capturing are happening then, not that is the second job you go back and do after you address that family. So again, I think it's really about designing the other way around, right? So not designing to capture data and the measures, but to really design thinking, what do I need to do to support my workers who are serving these families now? And ultimately, what you need out of that will come out of that. It'll just be a different perspective that you take in doing that.
Yeah, no, I love that. I was talking to an industry colleague a couple of weeks ago about that. The data collection is going to occur at the natural point in the process.
That's right.
You don't have to have a form to collect the data because you're just going to be gathering it. And if you have the right solution in place to do that, it'll do that. Now, one thing that you are, and I'm like, we didn't script this, folks. So I sometimes throw hardballs. This is not a hardball, but it was something that came up this morning. I was actually talking to some other Diona folks on another project that I was working on. And we talked about this idea similarly about forms and different
Yeah.
things. So a lot of what happens when we think about systems modernization, and I've been part of many of these projects, is we go in and we write a bunch of very detailed requirements.
Mhm.
And those detailed requirements are based typically upon how our current system works
Mhm.
and how our current processes work. And so then you go off and you build the new system to do that. When you do that, you are not you're not maximizing the potential of that new technology. So when you're working with your tech organization, whether it's a SaaS vendor or whatever you're doing, there are opportunities to truly enhance your business processes in such a way that you are going to exponentially improve the benefits of implementing that system. And forms is a great area to give an example of this, right? So in state government, we love forms. We have lots of forms. PRXY 450, right? We have all the forms. And if we look at how we implement those in a mobile solution, I forget the word that Patrick told me you use, mobile controls, I think he
Yes.
called it. So
Yeah.
if I'm doing a form, because we have to have the form, in my filling out a paper form, it could be 20 pages, right? But maybe I don't need to fill out all those fields. I don't need to see the fields that don't apply to me. So when we start to think about the business process of a form and data capture, all of that can be built in so that it streamlines the process, it makes for a better experience for the user, and it still satisfies your compliance obligations. But what sometimes happens is the state's like, oh no, we have to have the form in this full format. So then we
Yeah.
have to, there's some education and collaboration that happens there, partnership in terms of saying, okay, we can still do that, but it's going to look a little different on a mobile device than what it looks like on a website or on a piece of paper. And so that's a really important way that you want to work with your tech providers to really truly maximize those capabilities.
Yeah, and I think that's a great example of being focused on the outcome. The outcome is you do need it in this standard form because that's what's required by court, as an example. So that's the outcome. But what you can think about is there a better, easier way to be capturing that information? Is there a better, easier way for your family that is working with a caseworker to sign that document, right? So again, that's a really prime example of we know what the outcome is. Let's think about how we leverage technology to create flexibility without adversely impacting the outcome we need to achieve. And you're absolutely right. A lot of times the conversation starts with, this is the form, this is the order we do it in. And there is a lot of discussion that then occurs around we can do this differently and achieve the same thing. It's a much better experience for your worker. It's an incredibly better experience for your family as well, because they don't feel driven by the form. They feel like you're having a discussion and the form is an output of that discussion.
Yeah. Forms and reports should be outputs of the work.
That's right.
Yeah.
That's right.
Dr. McKnight, do you have any in your experience, anything to add into here in terms of where technology could be an enabler or where maybe it might have been a burden?
First of all, I just want to respond to a couple of things that you both have talked about. First, and it kind of links back to leadership again. When you talked about that form and doing what we normally do, kind of setting it up the same way. And what I was hearing from a perspective of being a leader, it's not just about setting up what the process is. Where do you want to go? And as a leader, you need to be thinking about, we may be here, but we really want to take this opportunity to get someplace further ahead. I also think sometimes we're so locked into we have to do it just one way, and really thinking about from the importance of having a diversity, because people show up and produce in different ways. So you can't, it isn't one size fits all. People are different. So really creating an environment where you have these different aspects available to them, because a lot of times we can be very narrow. So I think it's an opportunity for leaders to kind of actually look and do things differently as well.
Mhm.
Do want to, though, respond to a couple of things. First of all, with regard to attrition, one of the things that is recommended is that some form of mentorship or coaching program. So it's really important to have structure in place that supports users. I know we've done this work in the past where we have super users where they actually lean in, and because they're much more equipped. But actually, if you connect that back to attrition, it actually, when you have these types of structures in place, it actually lowers attrition rate by 6%. So there is a connection there. I also wanted to highlight the importance of when there is a glitch in the systems, whatever they may be, glitches do happen, that it's important to have a system in place to respond very quickly. Because what we normally do is we put in that help desk ticket and it's several days before you get that doesn't line up with the needs and the demands of individuals that are attempting to serve in social services. I also want to just say, as you do this, is word of mouth. It is a real thing in social services. It's a real thing. So that all you need is one bad experience, and then all of a sudden it just doesn't work. It doesn't work.
Yeah.
It overshadows.
Yeah.
So it's really important to make sure that when you do have those glitches, that you actually are being as responsive as possible. I also loved what Patty said around the human aspect of the work. Social workers come because they want to connect with people. That's why they come to the work, not necessarily to actually do some data input into a system. So whatever system that is actually developed needs to actually have that value component to it, because that's going to be something that's going to resonate more with those who actually are drawn to the field.
Yeah, definitely.
Yeah. I mean, the thing I would add to that, and usually why they leave, is because of the workload and the fact that they feel like most of their time is being spent on duplicative administrative tasks, not the social work that they came to do.
Mm-hmm.
Correct.
Yeah, I was working on a project in a state a couple of years ago, and I met a woman who had worked for the SNAP agency, and she had just moved over to the child welfare agency. And she was only there a couple of months, and she said, I don't know if I'm going to stay. Like, we don't have tools to support our work. I've got file folders in the back seat of my car.
Mhm.
I am not, I can't even believe that we don't have tablets or ways in which we can connect from the field. And so it is important that we're providing the right tools and capabilities to support the workforce for those purposes. It decreases risk in so many ways also. But yeah, thanks for sharing both of those things. In terms of the supervision, we've talked about supervision, we've talked
Mhm.
about leadership, and I think I remember early on when mobile first started getting popular, because I've been around that long. um, there was reluctance from some leaders in a certain state that I visited, and they're like, I don't want our workers having these mobile tools. I want them in the office. And I'm thinking, how can that be? They're like, social work is done in the field. But then also there's some reluctance perhaps early on in terms of the workers, like, oh, now they can monitor me everywhere I go. Do you see is that all sort of going away now? Are we
Yeah, I mean, that's a really great point. I mean, I've been talking about mobile for years and years now. And, it's really interesting because, as we all know, government team seems to lag a bit behind other industries. So often, even years ago, you could turn those conversations around and sort of ask questions like, well, how do you shop? How do you bank?
Yeah.
How do you call a car service? And then sometimes there's this moment of, oh, you're right, which then quickly gets you into a very important conversation, which is around security. So sometimes we talk about, well, that case file in the back of the seat isn't very secure either. So it feels, it has felt new. I think government, with the way technology is evolving, I think is completely evolving as well. And I think there is more of an appetite to really be thinking about, we need to do something different, right? We are not appropriately supporting our caseworkers who come here to do social work, right? They don't come here to do administrative tasks. There are so many benefits in doing this. And again, I think the thing Dr. McKnight said can't be said enough. This should be an agency change, right? This isn't a technology project. Any technology project is going to fail if it's considered a technology project. So I just want to highlight that again, because that is so, so, so important for any technology initiative that you are going to take on. But I think one, that is very focused on your caseworkers needs to be supportive around this idea of, we're not trying to have you all be exactly the same, because people are not exactly the same. So it's really in thinking about, we want you all to have the same sort of outcomes achieved in a way that best suits you and the families you are serving. And if you think of some of the things that can come out of that, it's been shown, and research has shown, that the quality of information captured during an initial engagement is always better and more accurate than when you take your 4 bullet points that you jotted down on a piece of paper and then try to create your notes as a result of that. So we talk a lot about and have seen it proven that the quality of that data is just so much better because you are capturing it as it's happening. Timeliness, right? There are all these time constraints around, and policy and reg. Again, the goal here is to meet those. It is very hard to meet those when you are doing your work and you're in the field for 3 days, and then you come back and you need to enter all that information. So the timeliness of the data, when you think about how to better enable your frontline staff, is so much better. We've talked a bit about supervision. That's a really incredible one. So if you think about what happens now and think about perhaps new caseworkers going out in the field, they're out in the field often after their training's done on their own, right? And sort of the only way their supervisor is getting an insight into what's going on is if they pick up the phone and maybe call them. If you think about capturing this information as it's happening and capturing it in a really secure way, it improves collaboration. It improves communication. Your supervisor can immediately be seeing what's happening. Your supervisor can see that picture that you took of a home and maybe based on their experience, provide some insight into really whether that is a concern, or maybe that's just there are some dishes in the sink, right? Because there are varying perspectives on what's clean or what's a problem. So that idea that you can more constantly being supported, not you're out there and then you come back and then you try to download everything that has happened and get some insight. So we talk a lot about that as well. The flexible approaches can't be denied. Again, this idea that you have very senior experienced caseworkers who are used to the yellow legal pad, which again, I was a yellow legal pad, so I get that. But think about doing the same thing of writing, but actually doing it where it's being captured electronically. So again, you want to support that idea of I'm more comfortable that way. Your newer workforce, I think most of them would say I haven't written a note in years. Even when I was going to college, we did not write our notes this way. So again, that flexibility around achieving the same outcome is really important. And what it demonstrates as leaders, that we're acknowledging we are focused on our workforce and we want to be supportive in the way you work, not in the way we want our technology to work. And again, this would never minimize. We know there are things that need to be achieved. So we're not talking about not getting the data. We're not talking about not being able to measure outcomes. We're just talking about better supporting our frontline staff who are the face to families and clients that we are serving. And if we're not supporting them, it's hard to understand how we expect them to support families.
No, that's powerful for sure. Yeah, and I did want to touch on one thing. You mentioned earlier intuitive. We
Yeah.
talked about having folks at the table. One thing we haven't talked about, and I'm going to bring up because I know your solutions, is when we think about acceptance, right? And the ability to use things. I was just talking to someone else this morning about training and how training has so drastically changed over the years.
Yes.
And we used to bring everybody into a room and we would train them all at once and we would give them these awful training manuals. And then we graduated to PDFs of the training manual. No one looks at those manuals, right? Like rarely.
Yeah.
The way that we train now is so different because the acceptance of the solutions is so different. And because Diona uses, first of all, human-centered design, subject matter expertise to inform the design, but also because it is what we refer to as native mobile. So if you're not familiar with that term, it leverages the capabilities of the device you're using. So you already know how to use the device. You already know how the camera works or how the GPS works or whatever you're using. And so the Diona interface is even designed in a way that's highly there are standards for how you design on mobile that makes that also easy to use. It requires less training.
Yes.
So you don't need to bring people into the office every single time you make an update.
So what the training really ends up being focused on is not clicks, not like, how do I get from this page to the next? Because again, if that were the case, then we as a product company failed. Because again, our whole focus is on the user experience and making it intuitive. And also because we are health and human services focused, we expect to have met some of your use case right out of the box. So what we really want to be engaging on is your uniqueness. So that training ends up really being more about your actual policies and practice, right? So we're not talking about clicks. What we're talking about are things like, this will be in draft until you decide to submit it. And when you submit it, it is in your enterprise case management system. So we're really talking about the flow of information, not how to use the solution. What we also then focus on is really developing comfort around how to use these solutions when you're engaging with a family, right? Because most to date have gone out with paper and pen. And it's family sits over there and I sit over here, or I stand at the door if I'm an investigator because you don't want to let me in, and I ask some questions. So we also spend time really talking about, well, let's think about how we leverage the device to create engagement with this family. Think about how if you have a child, perhaps you give them the device and they are drawing a picture about their family. And that is automatically in the case note, not a piece of paper that's in the paper file that no one else gets to see. We talk about how you turn it around and let these families see what you're recording, because there are no secrets. This is their family you're trying to help. So our training ends up being different, right? It's not how to use technically the system. It's how to leverage this solution to better support you in your practice.
Thanks for that. And I brought that up too, because Dr. McKnight earlier mentioned about, having support.
Yes.
So much of the support is provided in different ways. It's provided in a better, more intuitive design. I mean, that's not addressing any potential glitches, of course, in your example, but I think the way people learn and train and get their support is a bit different now.
Yeah. Can I add one more thing to that?
Sure.
Just because it is an important aspect. So as you invest in giving your caseworkers solutions, it's important that you give them solutions that work. And by that, I mean work all the time, regardless of, again, their moment of engagement. Their moment of engagement could be in some rural location with no cell phone coverage with no internet. You don't want to send them out there with no tool then, right? You've given them something powerful. So again, thinking about those moments of engagement has you thinking about, well, how do I give them something that works all of the time, not some of the time? And you take that into account so that your workers aren't sometimes using, sometimes not using. And this goes back to this whole idea of, utilization and using it and being bought into it, and it always making their job better, not just sometimes making their job better.
Sure. Anything to add on to that, Dr. McKnight, in terms of the support and all of those things? We covered a lot of territory.
The example that Patty just shared with regard to when technology doesn't work and you're out in the community. I just want to share when I first relocated to North Carolina, one of the things I wanted to do is to really kind of get a sense of my team. So I went out and shadowed with them. And I went out about like 9 o'clock at night to on a call. And we actually have laptops in this particular county where you could actually complete a safety assessment right there on the spot, which was fantastic. However, the internet wasn't connecting. It was not connecting. So it was like, it was a good learning example for me then to know that we needed to support the staff differently because I was right there in the moment and I could see how this could be an issue. Not to mention there were about 11 children that needed to be assessed that night. But that was the reality of the work. That's the reality. Those are some of the challenges that the staff connect with. I also wanted to highlight too the use of technology, because I am a supporter of technology, even though I am one of those yellow pad social workers for a time. But I do want to say COVID actually, there, those were the moments where we had those bright spots kind of thing, even in the midst of so much loss, where we had to learn to use technology very, very different. And wondering if we could still continue to channel some of that energy that we had, because how we actually assessed safety of children, as well as the strengths of a family. We really need to rely heavily on technology and sharing technology with clients and customers. It was a total different experience, but it was a shared experience because everybody was trying to keep themselves safe, but they understood that there's something had to occur. So it was so important in this time when we did learn how to use technology and leverage it in a way that was meaningful and to still connect with clients and customers.
Yeah. I'm so glad you shared that experience, because I was even thinking about, just the fact, Patty mentioned it earlier too, like we all use devices all the time in all aspects of our lives now. And, I'd mentioned there was a time when clients probably wouldn't have welcomed these types of technology in their home. But I think Patty can attest to this. What we've been hearing in recent years is that clients actually like to have these conversations recorded, because rather than someone else paraphrasing what I said, you now have a direct record of what I actually said. And so obviously we would encourage getting consent and all of that first. But I think overall people want to know that there is accuracy in what's being documented. When you had your yellow pad and you were like kind of writing, we didn't always share everything. Maybe it was blunt, maybe it was drafty and raw, and we were concerned about that. But the part about what I've shared with you, those are my words, and I would like them accurately reflected. So I think that's been a big cultural shift for us, again, post-COVID and the emergence of, everyday technology.
Carol, can I just touch on one additional item before we shift kind of? I just wanted to highlight, we touched on it a little bit around the issue of confidentiality and Patty's remarks, particularly around the case records in the back of the seat, kind of really being thoughtful about that. But I do think that it's important to add emphasis to the importance of safeguarding systems. many social workers, and this is just, it literally is part of our code of ethics around confidentiality, and really recognizing that many of the individuals that we are actually served are already vulnerable, have already been compromised. The last thing you want to do is to have a breach of some sort. So I do think it's important to just add just a little bit more emphasis to that, because I think it is important and it is a value. It is a value that we have professionally.
I agree. Absolutely. I did ask if anyone has any questions. You can drop those in the chat now. And while we're waiting to see if anything comes in, I didn't know, Patty, if you want to have any kind of final comments, parting comments for our conversation today about how technology can support workers.
Yeah, I think I would just say that there are small changes that can deliver immediate value and have a huge impact on the workload of your caseworkers, the morale of your caseworkers. And it's possible now. I think what we've seen in the market is there's this real focus on I need to address my case management or my eligibility or my child support system. I need to address that. And then I'll think about other ways to perhaps enhance sort of the experience of our caseworkers or our clients even. And I think with technology and where technology is right now, and it's certainly just talking from a Diona perspective, our focus is on making sure that this can happen now. You can leverage your existing technology investments, your existing technology solutions to deliver what we would consider caseworker first solutions. So you don't have to think about, I massively need to overhaul what I already have. You can think about ways that you deliver caseworker first solutions, leveraging what you already have.
Thank you, Patty. 100%. Yeah. Those systems need to be overhauled. We know that they are, some of those systems that are out there are 30 plus years old in some cases. And so, yes, but you don't have to do all of that. You can get this immediate relief to the field while slowly modernizing that back end that is so critical to the rest of your operations. Also, we didn't even get into this, but this is a really cost-effective solution. If you can't do anything else, you can do this. That's what you should do, because we obviously are well aware of the massive budget cuts that agencies are facing. And because you have a budget cut, you may feel like you can't do anything, but you can do some things. And so when Patty said, small things can have big impacts, this is one of those things. So, and it also can help you address some of those other pressures that you're facing too, with the many regulatory changes that are happening right now. Dr. McKnight, parting thoughts from you.
I was able to kind of weave a lot of my closing remarks in, but the last and final thing that I think is important for me to add emphasis to is, again, to highlight the importance of actually having staff at the table. I think it is absolutely in one of the most important things that we can do in system design. And I know that isn't always the way we have practiced, and that is a huge shift. It's almost like giving up power, kind of thing. But I'm telling you, this is a different workforce. And I think we can actually get a lot more wins if we're able to shift with where they are at this point. So,
yeah, I agree. And when you were talking earlier about, one, person that has a negative experience can really, have a negative impact. The same can be said of somebody that had a really positive impact, right? And so they're going to go out and they're going to share that wonderful experience, and they're going to get their colleagues to be like, oh my goodness, you should see how great this is, how much it helped me in my job. So thank you for that. Thank you both Jacqueline and Patty for being here today and being part of such a thoughtful and grounded discussion. We're not talking about things that are pie in the sky. These are big challenges, but there are certainly some great solutions and ways out there that you can make an impact quickly. for your workforce and ultimately for the people who you are serving in your programs. I'd also like to thank those of you who joined us today, and more importantly, for the work that you're doing every day to support individuals and families. We know how demanding this work is, and that conversations like these are really about supporting you and your teams. And at HHS Connect, that's exactly why we exist. We're really trying to build a community here that focuses on people who are shaping the future of human services. And so we're bringing together leaders from across programs and technologies and operations to have these honest conversations and share what's working and perhaps what's not working, and help to elevate practical solutions that can make a difference. So this webinar is just one part of that. We hope that we'll see you again at a future webinar or event. We do have a whole learning management system and a professional development network. So looking forward to engaging with all of you again in the future. And if today's discussion resonated with you and you want to stay connected, definitely reach out to us. We would love to get you connected with Dr. McKnight or with Patty regarding mobile solutions. So do feel free to reach out, and we look forward to seeing you again in the future.
And Carol, real quick before you end, Amy did put one comment into the space, and she said, I agree with everything that's been said. Many great points shared about the HHS workforce and supporting them with flexible systems to improve their daily work. Thanks for sharing these insights.
Thank you, Amy. Thanks for coming.
Thanks, Carol. Thanks, Dr. McKnight.